Hi everybody, Sharice here. So if you are watching this, you may be listening to this on the Goddess Life podcast on iTunes, Google Play, Libsyn, and most podcasting apps, or you are watching the video either on IGTV or on YouTube. If you're watching the video portion, you may notice my eyes moving around a little bit, and that's because I'm recording the YouTube portion on my laptop, and I'm recording the IGTV portion over on my phone. So apologies if that kind of bothers you of me like looking in two different places. But it is what it is, and so here we are. All right, so today I'm going to talk about physical fitness with endometriosis or any chronic health condition or like chronic pain. But I'm specifically going to be talking about endometriosis because that's what I have. And so hopefully this will kind of help give you guys some hope. Those of you who are being physically active with a chronic illness or chronic pain, some like hope or to make you feel better about things. But okay, so if you have endometriosis or any chronic pain or anything, you know that it makes your life difficult. It makes things that may come easier to other people a little more difficult for you, whether that is just like everyday life stuff, like doing the laundry, housework, going to work, taking care of kids, like whatever. It can make life a little more difficult. Especially a lot of the time too, it can be unpredictable. Like I know with me, with my endometriosis, I may go like a few weeks feeling pretty good. And by the way, my feeling pretty good is still usually I'm in some level of pain or discomfort. And I think a lot of people with endometriosis or other chronic pain or, health conditions can relate to. It's like, even when we're feeling good, like there's still a level of like not feeling so good. It's just, we've gotten to the point of like, this is like what it is, being in some level of discomfort is my normal basically, which that's kind of a sad thing to say and admit, but it is what it is. Anyway, so that being said, physical activity can really be hindered by endometriosis. And rather than me keep saying endometriosis and other conditions, I'm just going to say endometriosis, but if you have some other condition, know that is in there as well. But anyway, so endometriosis can be, some of the symptoms can be alleviated a little bit by being physically active. So it's kind of like this double-edged sword. It's like, be more physically active to help your symptoms in the long run, but in the short run, like it's going to increase your symptoms. So basically, like when I work out, it can throw me into a flare-up. Like I can work out and then for the next few days be in a lot of extra pain, swollen, bloated, all of that super fun stuff. But the thing is, in the long run, being physically active is really good for our bodies on every level, even with endometriosis, because the more sedentary we are, it's not good for our bodies all around, whether you are, perfectly a healthy human being or you are somebody with a chronic illness. Being sedentary really isn't very good for our bodies. But so here's what we need to do. Instead of beating ourselves up for not being like, a fitness guru, we need to accept ourselves where we are and be honest with ourselves of what our bodies can and cannot handle. And this all comes back down to, I talk about this a lot, of just being honest with ourselves, of being really aware with our bodies and what's going on with our bodies and being honest with ourselves. Because there's a difference between, all right, my body can't handle this today. Like I literally cannot, I really need to take this day to just kind of take it easy, rest, whatever, versus I just don't feel like doing this workout today and I'm just going to say it's because of my endometriosis, which I've done that before. I've been like, I'm feeling a little uncomfortable today. I'm just not going to go to the gym, or, I'm just not going to get my steps in for the day. But then when I'm really honest with myself, I'm like, okay, again, I'm at some level of discomfort any day. So, I mean, if I use that as my excuse, like I'll never be physically active. But, so a lot of the time it is like, I'm just using it as an excuse and I could kind of push myself. So that's one thing to be aware of, is being honest with yourself. Could you maybe go to the gym? Could you maybe do something physically for yourself today? If the answer is yes, then go for it. If the answer is no, then honor that. And that's something I've struggled with, is my brain is telling me like, go, go, go. Like, let's go to the gym. Let's do this. Let's lift these weights. Let's do the yoga. Let's do the whatever. And my body's like, nope, nope. Particularly my uterus and my ovaries. They're like, no, not today, not today. And I'm like, oh. And then you feel guilty almost, because it's like, you know, you quote unquote should be doing this and you want to be doing this, but your body has other plans and it can make you feel guilty. So number one, don't feel guilty about it. You know, it's you honoring your body. It's you listening to your body. Your body knows what it needs. Your body knows if it truly needs to rest that day, then rest. If you can push yourself, then push yourself. So that's the first thing. The other thing is you got to be patient with yourself, because you may not be able to push yourself as hard as other people can, or as hard as you want to be pushing yourself. You know, maybe before your endometriosis like kicked off and, you know, was super awesome and affecting your life all the time, maybe you used to be able to work out for like an hour, but now you can only do 15 minutes. Whatever you can do as far as a workout, praise that. Like, be happy for that. If you can only do 5 minutes of like light yoga for the day, like honor that and be proud of yourself for doing that 5 minutes of yoga. If all you can do is take a walk around your block, a slow walk even, because I've done that before. I'm like, okay, my body is pretty like not working with me today, but I feel like I can do some sort of movement. Let me at least take a walk around my block. If that's all you can do in one day, praise that, like celebrate that, be happy that you were able to at least do a walk around the block. So basically like celebrate where you're at and be proud of it. You know, if maybe one day you can go to the gym and you can knock out a 30-minute workout, like 15 minutes of strength and 15 minutes of cardio, frick yeah, man, celebrate that. Write it down in your planner, your journal, whatever, if that like, hell yeah, I did this awesome workout today, and celebrate that. Congratulate yourself on that. So basically just kind of honor where you are rather than beating yourself up. So if you did just 10 minutes of a workout today, rather than being like, oh, I only did 10 minutes, I really wanted to do 30, blah, 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 and like beating yourself up about it, instead be like, hell yeah, I did 10 minutes of a workout today. Like, woo, that's awesome. So basically just like celebrate yourself where you're at with your workout. It doesn't always have to be this crazy, crazy workout. Excuse me. The other thing is you may need to, that's my dog, if you can hear the chains jingling. Another thing that you may need to do is switch up your workouts. You might not be able to do the workouts that you want to do. Like for me, I know I can't do a lot of workouts that really like crunch and constrict my pelvis and my core. So like I basically cannot do any sort of crunches or sit-ups at all. I can't do the rowing machine because that's a lot of like squishing of my pelvis. Even sometimes planks, because that's engaging your core. I can't do that a lot of the time. And so it's really frustrating sometimes because I'll be watching you know, like workout videos to try to get some inspiration, or there's different moves that I want to do and I can't. So the other bit of advice would be to just tweak the workouts to what you can do. So if you're doing like a workout video and they're doing a bunch of ab stuff, maybe in place of that, instead of doing crunches, you could do extra lunges or something, or, you know, you could do extra push-ups. So you can tweak it. So that's something I've been doing, like, you know, like I said, if I'm watching a video, like I was doing yoga with Adrian, and the whole video, it was the 30 days of yoga with Adrian. And one of the videos was just like all core stuff. And there were a lot of like the scrunching of the pelvis. And I'm like, okay, I can't do that. So instead I just held like a downward dog, or, you know, warrior pose or whatever. Like I just switched it up and did what I know my body can handle. So don't be afraid to switch up workouts. And also, side note, you don't have to do like the crunches and the sit-ups and all of that and the bicycle twists to work your core. You know, doing push-ups works your core. Doing planks works your core. Doing different yoga poses works your core. Like you don't have to do a lot of the scrunching stuff to activate your core. Even if you're just standing there and you're doing, you know, arm weights, just activate your core. Like make sure your posture is good, make sure your core is engaged, and you're working your core even doing that. So don't beat yourself up if you can't do the core workouts. But so I guess that's just kind of my advice. Like, honor where you're at. Don't be afraid to tweak workouts if you need to. Don't be afraid to take a day off if you need to, and celebrate your little wins, no matter what it is. Maybe you just did 1 minute of yoga or like whatever. Honor where you're at and celebrate it. And I hope that that helps. It's really helped me deal with not being able to be as active as I want to be. I celebrate my little wins. I push myself when I can. I take it slower when I can. Basically, I didn't do anything for 2 weeks, by the way. The week leading up to my period was horrific and I was in pain. And the week of my period was horrific. This was a really bad flare-up for me. So I didn't do anything for 2 weeks. I did nothing. My body didn't even want to do yoga. I was like, well, maybe I'll do yoga tonight. And my body's like, hell no. Nope. And that's okay. So like, it bummed me out a little bit, but instead I focused on the next day that I was able to go to the gym, and I celebrated that. Oh, also recovery time. Your recovery time is probably going to be longer than other people. You know, you may go to the gym, and rather than just needing to take like 1 rest day, you may need to take like 3 rest days. So that's okay. Honor that as well. Don't feel like you need to push yourself just because other people can push themselves. You know, honor it if you need to take a little extra time to recuperate. Also, be aware of how working out affects your body. Like, I know for me, even before I got really sick with endometriosis, I'm just somebody that gets really tired when I work out consistently. So now with my endo, that's even more prevalent. So I just am more aware of making sure I get, you know, solid sleep. I'm making sure that I really am increasing my water intake, taking supplements. I also am proactive. And before I work out, I will usually take a copaiba supplement that I have because that helps with inflammation. So I'll take that. I'll use different oils to put on my lower back because my endo really like flares up in my lower back and my pelvis, obviously. So I'll put oils on my lower back and my stomach, just things to be proactive and to really help my body transition through the exercising. But so yeah, so all hope is not lost. All hope is not lost if you have endometriosis or any other chronic condition. You know, you can still lead an active lifestyle. It just needs to be tweaked specifically to you for how you're feeling that day, because again, it's super unpredictable. All right, but so I hope that helps, and I hope you enjoy your workouts, whatever they may be. All right, bye.